Good morning, everyone. This is Dan Mogulof with the Campus Office of Communications and Public Affairs. Thank you for joining what is an extraordinary session or extraordinary version of our Campus Conversations event. We can't see you, which is unusual, but I trust that you're there given the level of interest and concern across the campus community. I'm honored, really pleased to be joined today by members of the campus leadership. They will be answering questions that we have been receiving from students, from staff, and faculty. Quickly, I'll introduce them, and then we'll get going. First, we have Chancellor Carol Christ, Executive Vice Chancellor and Provost Paul Alivisatos, Vice Chancellor of Administration Mark Fisher, Vice Chancellor Student Affairs Steve Sutton, Assistant Vice Chancellor for Human Resources Eugene Whitlock, and Assistant Vice Chancellor of University Health Services, Dr. Guy Nicolette. Thank you all for joining us this morning. Carol, I'd really like to start with you first. Earlier, you sent an extraordinary message, a message of gratitude to the campus community. I imagine that's a message you never imagined you would ever send. Talk to us a little more about what you've been seeing, what you've been hearing, what you've been thinking and feeling during these extraordinary times.
First, I want to repeat my thanks to the campus community. The work of people has been just extraordinary, adapting to unforeseen circumstances and really working together as a community. There's so many really inspiring examples that I hear every day of the ways in which our community is responding to this crisis. What I have as foremost in mind is protecting the health of the community. That's what's most important for us all. We all have to maintain social distancing and to protect not only ourselves, but all of those around it. Then secondly, we're very focused on providing education for our students. I feel for some faculty, it's like being thrown into the deep end of the swimming pool without swimming lessons, but people are adapting amazingly and creatively to moving our entire educational program to remote delivery. And then finally, we're really focused on preserving the jobs of the community because when we come out the other end of this, we want to be the strong, resilient university that we've always been.
Thank you. And given the fact that the health, our own health, the health of our loved ones, the health of our friends and colleagues is really front of mind, Guy and Nicolette. Guy, talk to us a little bit about first, the general situation. I think the latest count is that there are 11 active cases in Berkeley. What's important for people to know, do, and understand right now in the medical/health?
Yeah, thanks, Dan. You're right that the latest count for the city of Berkeley is 11. The latest count for the campus community is 5. I think it is important to understand that those numbers are going to be more challenging to interpret. Who gets counted under which paradigm, but I think one of the factors to consider is that we're going to have more cases here, and the chancellor is right that the best thing that we can really do is protect our most vulnerable population, maintain physical distancing the best we can while maintaining social networks. I don't want to forget mental health aspects of social isolation and social distancing, and so we're really trying to remind people that it's important to maintain your social networks while maintaining some physical distance. The situation right now is that at least from that we are able to still see students and patients. We are offering a lot of services telephonically or even and now with video, that we are still seeing patients in person, patients and clients, but has been strained. But I think we're up for this challenge. And I really see us turning a corner a little bit in ability to reformat our services to best help the community, but also be there as a medical resource for those folks that do have questions. And that, again, are probably at the early stages of local increase in cases, and we're really trying to, as people have seen all across social media, flatten this curve locally, if not regionally.
So speaking of flattening the curve, if the early governments were effective and begin to take effect, a lot of people are wondering, when would we start to know that the curve has been is flattening?
Yeah, that is quite a question. We won't know until we really get into this. It'll almost be so late that we won't be able to adjust, because we just expect such an increase that can happen even in a day or 2 days or 3 days. My personal opinion, and this is not based on evidence yet, but my personal opinion is that California and Berkeley acted early enough that we really should see some flattening of the curve. How much is really the $64,000 question.
So I'm going to stay with the health and sort of medical realm for a few more questions, and this might be either for you or for Vice Chancellor of Administration Mark Fisher. We've been getting a lot of questions from members of the campus community about PPE, personal protective equipment, and for research and for other sorts of sectors of the campus. What are our plans? What are our thoughts? Where do we stand with that at the moment?
Well, I can certainly start with very local answer. We're doing okay on PPE. Our biggest challenge right now are for healthcare providers and specific mask sizes. As you may know, the respirators, these N95s, come in different sizes, and you're fit to them. And so we're running low on some of the supplies, but the system has started to really think about a system-wide response to the masks, and I'll let Mark fill us in on the details. But within a couple of weeks, we probably would start to be critical on face shields and masks if we don't have some increase in our supplies and a more robust supply chain.
Mark, do you want to add to that?
Sure. Divide this into a couple different pieces. First of all, there's been a lot of question about personal PPE. Folks out there who have access to or have in their own supplies at home or through family or friends access to PPE. They should feel comfortable donating that directly and not weaving that through the university. On the university side, basically anything that's on the campus, whether it was purchased with grant funds or UC funds, should be treated like UC property. And the request from the Office of the President is for us to coordinate with them those supplies, primarily because they are worried about the very thing that Guy just talked about, was running out in our medical enterprise. Also, we've been cautioned that the PPE that's available on campus may need to be available for us through the wave of COVID-19. But also there's concern about fire events and other sorts of events. We might need that same sort of protective equipment. So we're exercising a lot of caution in this area.
Yeah. On a more, I'm not quite sure how to define this. It definitely connects to the medical issue. And that's the issue of xenophobia. The issue that certain people are responding to the current crisis with clear actions and words, discrimination against people because of their origins, for example. Any of you, what's the message you'd like to send in that regard? Guy, let me turn to you first as a physician in that regard.
Yeah, that certainly was an issue early on. Messages going out, particularly on social media and even in person, about discrimination or xenophobia targeted against a particular appearance or a presentation. I think at this point, there are cases in every country. There are cases all across the U.S., but yet we're still hearing some pockets of xenophobic response. And standpoint, we certainly have had an increase in students and in other faculty and staff that want some behavioral health or mental health assistance with this. And so we're ramping up our virtual capacity, both with some group sessions, even maybe possibly some drop-in sessions to help people through those times in a more reactive way. I would say on a proactive way, we can't forget that this response is not normal, and we really, I think, ought to not forget about the educational opportunity that this provides us to continue to reframe what is really normal and to normalize this.
Yeah, I'm going to ask one more medical question, and then we're going to transition to some broader issues about the campus and about educational and budgetary issues and the like. But before doing so, I want to remind everybody watching today that we are continually updating a campus FAQ page about COVID-19. You can access that through berkeley.edu. Last question, Guy, about testing. Who are we testing? Who can be tested? How are we making that decision at the moment?
Yeah, thanks for bringing that up. That's a really common question that we get both with patients calling in, students calling in, parents, and in fact, the whole community. Right now, I think it's safe to say that we simply don't have enough tests available at the current moment. And I know that there are a number of, the CDC is working on it. The private testing corporations have really started to mobilize, but we're still probably weeks away from really seeing an expansion in that front. I'm really encouraged that Berkeley has taken the initiative, and through the research arm at Genomics Institute and even LBNL to try to solve this issue locally, if not for the world, by exploring new ways of testing and testing at a higher capacity than what's currently available, and probably testing at a better accuracy. So we're exploring ways to expand that testing locally through FDA exemptions and FDA approvals of new test kits, and then with clinical collaboration with the research front, start to really test more folks. And it would be a game changer locally if we were able to really test and truly understand the local epidemiology of this virus. I think it would really put us ahead if we can mobilize. And it sounds like we might be able to do that within a couple of weeks.
Great. So we're going to move on to some budgetary questions, some campus operation questions, but I also want to convey to students and parents who may be watching, we have a number of questions that have come in for that portion of the campus communities to stand by. We'll get to them. So clearly from what we've been seeing, what we've been reading, there's general awareness, even a fear regarding the financial impact of this crisis on the campus. And people are concerned about their jobs, the possibility of layoffs, about the sort of long-term impacts this crisis may be having on the financial health of our campus. So let me turn to the Chancellor and Provost for a response and sort of an update about where we are.
Thank you, Dan. We are deep into an analysis of the financial impacts of COVID-19 on the campus. It's a very important question for us to explore, obviously. We expect to have a greater understanding by next week, and we'll begin communicating that to the campus. But meanwhile, I want to assure people that preserving people's jobs is a very, very high priority for us. We want to keep our workforce not only safe and healthy, but employed.
So Eugene, let me just sort of pick up on that and ask you the idea of keeping our workforce safe, healthy, and employed. Talk to us a little bit about what your office, the Office of Human Resources, what you're hearing and what you're doing and what you're planning for right now.
So what we're hearing is that people's morale is actually quite high. And so in light of this challenge, people have stepped up to the challenge and are pulling together and finding that they can continue to work remotely. And as Guy mentioned before, continuing to maintain their social networks. So that is critical for us to get through the crisis. Yes, our physical health is important, but our mental health is equally as important. And so we're encouraging all managers and supervisors to have daily meetings if possible with their employees, even if it's just for 15 minutes to have a stand-up remote meeting. That's critical because also for a lot of our employees, their social connection does come through work. They don't have a roommate or they're not living with family members. And in terms of what are we thinking about in terms of preserving jobs, that is extremely important. But for now, before we know the full financial picture, right now we're making sure people have work to do. So if you're working remotely and you're not doing your regular job, we have programs that you can do for professional development that they're not, we just made it up to keep you busy. That's actually professional development that we all want to do and we all need to do, but maybe we didn't have time for. And so that we're doing that now. So for those people who are saying, I'm at home, I have nothing to do, there's a lot that you can actually be doing. And I encourage you to talk to your supervisor, go to our website yourself. You'll find plenty to do that's not busy work, but that's actually going to help develop you in your career. And you'll also find resources around wellness and mental health that you can share with your colleagues and also share with other people that you may be in contact with in the community. Because it's not just about taking care of our employees, it's also about taking care of each other.
So thanks, Eugene. Let me turn to the provost now. Paul, talk to us a little bit about what you've been hearing from faculty, your sense about how faculty have been adapting and how they're planning for what is a very uncertain future.
Well, Ken, first of all, let me say just how remarkable it is to see how innovative the faculty have been. And all instructors, they have those who support instruction, GSIs and others, the whole community, I think, has really pulled together. This abrupt transformation of how we deliver instruction is really incredible. And people have jumped into it and are doing it with a lot of innovation and a lot of good ideas. For example, at first, many people thought that some classes could not be delivered remotely, and yet within a few days had found new ways of doing that have been working very well, and indeed have been models for many other universities. So I just want to acknowledge that aspect of it, and also to say that our faculty and our research community, the graduate students, postdoctoral scholars, and others, have been very forward-looking. There's a lot of research going on COVID-19 itself, implications for economic implications, technical, scientific, every aspect of it, the research is being explored. Guy mentioned briefly the really, I think, wonderful efforts going on in the IGI, the Innovative Genomics Institute, to stand up sequencing as quickly as we possibly can with the necessary approvals. So I just think it's been very inspiring to see our instructor and faculty community respond with energy and with a lot of creativity.
So I want to turn a little bit and address some of the questions we've been getting from the student community, and I'm sure parents share many of the concerns and these concerns and questions. So let me ask first about graduation. Graduation is a while away, or up until a few weeks ago, 8 weeks seemed like a long time. Why was the decision made to cancel it now this far out?
The decision was made at this point because people really need to plan. There was a lot of anxiety in the student community about, will they have a graduation? What will the alternative be if we had to postpone? And it seemed to a number of us that it was just better to make the decision promptly and then start thinking about what the alternative would be.
That makes sense. Steve is the Vice Chancellor for Student Affairs, for those of you who haven't met him or seen him before. Talk to us a little bit about what your office has been hearing and what you want the student community, above all else, to know, do, and understand at this moment in time.
Yeah, it's a great question, Dan, and thanks for the chance to be here on this meeting today. As a general, I'd say our student population is very resilient. I mean, we have students that are very driven. They're very focused on their work. They really strive to do what they can to meet their goals and their aspirations. And that's what Student Affairs is all about, to really try to support them in that respect. But this situation is very unique, and it has presented many of our students with some challenges that they've not seen before. I think what Student Affairs is trying to do in collaboration with the Division for Equity and Inclusion, as well as Kathy Caution's area, undergraduate education, to really try to just be mindful of what issues students are facing. We had an example of students needing laptops, and so we acted very quickly to try to get some laptops in short order to help students that needed to have that technology so they could engage in remote education. We also are being very mindful of what's happening in and around the residence halls in terms of providing students with the support that they need. Also promoting that really important concept of social distancing. So there are a lot of things that are in place, and we've got people working remotely. We're offering yoga classes online via Zoom. The financial aid office is still helping students by cutting checks. So we've got lots of areas across the board that are doing what they can to really keep students focused and supported so they can address the things that are most important to them in terms of their instruction.
So I'm not sure if this may be a question for the Chancellor, but something that we've seen a lot, we're getting a lot of questions are coming in about whether there's going to be a tuition discount or refund, given that there's been a curtailment, or at least what we're able to provide now obviously wasn't what we thought we'd be providing in terms of an educational experience when the semester started. Carol, actually, let me turn to you on that. Where do we stand? What sort of discussions are underway?
We don't anticipate any kind of tuition or fee discount. We are, of course, discounting dorm contracts for students who choose to leave their dormitories and obviously stop their meal plans. But we are delivering instruction, although in a remote way, and students are earning credits toward a Berkeley degree.
So, Steve, I think that was pretty clear. No consideration. As people may realize, the Chancellor's audio is a little broken up, but just to reiterate the key point that there is no consideration being given at the moment, and there's no anticipation that will in the future for a tuition discount, and that we continue to provide classes through online platforms and vehicles. But let's talk about international students for a second, Steve. If they leave now, they might not be able to get back into the country. So can they stay over the summer? What are we thinking about? What are we planning for that important part of our community?
Yeah, I just want to say, Dan, as I begin to answer that question, that our folks in RSSP, Residential and Student Service Programs, have just been working so hard and really trying to be proactive for how we can try to address the students that are currently living with us, as well as needs like you're describing that may emerge in the future. I mean, we're very confident that if there is an international student that doesn't feel comfortable going home for whatever reason that might be, that we can certainly support them during the summer and provide them the housing that they might need, and encourage them to look at summer classes, summer session classes, where they can continue to make progress on their degree.
Got it.
Dan, if I could tag on to that a little bit from the internet, particularly from the international perspective and the student health insurance plan. We know that there are a number of students that either traveled back when this crisis started happening, or were already in international locations. And so we've worked with our insurance partner to try to relax restrictions to allow them routine care, because we don't know how long this is going to go on. So instead of just covering emergency care internationally, which is what the plan has, they were able to relax that restriction and allow routine care, allow extended prescriptions. So 90-day prescription fills, and then a referral requirement has been dropped so that folks that are distant from us can still get the care that they need. And I think that's been an important response as we start to think about the second and third and fourth generation of issues that this crisis causes.
Thank
And
you.
if I
Thanks.
could also just jump in on that briefly, we're doing everything possible to make it so that all students can have the most flexibility in how they can be involved in instruction and in advancing their degrees. So we're really trying every way possible to make sure that people, whatever decision they have made with regards to where they are, will be able to continue to do their academic work. And there's so much effort being done jointly with the Academic Senate on this that I think has really offered a lot of flexibility, incredible amounts compared to what would normally occur. And we're certainly very open to trying to find ways to help students to continue to advance their instruction and make progress towards their degrees, whatever their circumstance or wherever they may be.
Thanks, Paul. We're going to come back to the student part of the population, but I want to sort of make sure we hit all the various sectors of our community. Eugene, I want to come back with some HR questions that we've been receiving. I know your office has been receiving, and it's brass tack stuff, but these are the kind of things that people are obviously and understandably concerned about at the moment. First of all, let me just ask you about how paid administrative leave works, how it impacts perhaps differentially union workers, part-time workers, and if people have run out of work to do from home now, what do they do? I've given you a whole bushel full of questions, but take it and run with it, please.
Sure. So UC Office of the President has authorized essentially a bucket of 28 hours of paid administrative leave for people who are unable to work due to COVID-related reasons. So maybe you're sick yourself, you're taking care of a family member, your children's school or daycare has closed and you need to stay home and you can't work. So the way to think about it is, if you're not on site working and you're at home, can you do remote work? Yes or no? If you can do remote work, great, you keep working. If for some reason, one of these COVID-related reasons, you can't do work at home, then you can access the paid administrative leave. And it's available to represented staff, staff who aren't represented, student employees. It's available to everybody. The idea behind this really is, what can we do to make sure that our people are taken care of? We talked before about, employment and what's going to happen in the future. We're going to do whatever we possibly can to take care of them for as long as we possibly can. And as I mentioned before about, I've run out of work, really, you shouldn't be running out of work. It's been 2 weeks. I would be surprised if people at UC Berkeley have run out of work. Even 2 months from now, I would be surprised if people have run out of work to do it. And so if you don't think you have anything to do, I encourage you to contact me directly because I have a few projects I could use help on.
And what happens when the 128 runs out? Are we thinking down the road about that?
So yes, we are thinking down the road about this. So I convened a call with my counterparts at all of the UC campuses. And so we together have gone to the Office of the President and are having this conversation. There's actually a call happening right now. And part of that is to lobby UC to extend the 128 hours. The 128 hours came about, we think, in connection with the April 3rd, April 6th shelter in place. But now we know that's going to be longer. And so then the question is, does it make sense to have more paid administrative leave? So hopefully we'll have some visibility on that in the next few days.
Let me turn back to the Chancellor, Carol, a couple of broader questions here. What concerns you most now? And then on the other side of the coin, what's giving you hope?
Well, what's giving me hope is the incredible resilience and creativity of our community. It's just astonishing at this point of social isolation, how people are coming together to make anew this university that we all love. What worries me most is, of course, the course of the virus and whether we can flatten the curve, and getting through this crisis financially. Those are the two biggest sources of my worry.
Mark Fisher, let me pose the same question to you about in your realm, your professional realm. What are the things that are concerning you most now, and what's giving you hope?
I think the biggest concern today probably is just that we're fatiguing parts of the staff. We have an emergency operations center that's up and running. Crisis management team is up and running. Most of the people involved in those efforts are doing that work 7 days a week, oftentimes 14 hours a day. It starts early in the morning and ends late at night. The email is nearly constant. So I just worry about the exhaustion and providing relief. So one of the things we'll be working on or are working on are alternative staffing and figuring out how we can take advantage of a lot of people who want to be involved and making sure that we have them as involved as possible to take pressure off of those who've been doing this for a couple of weeks now. So that's probably my biggest concern. And then I think making sure that people feel like they have something to do. And Eugene's working on a job bank that I think is going to be a great tool where we can try to match up someone who may be feeling underdeployed with a group that really needs help. And an example would be this weekend, we're going to have a move-out effort in housing and making sure that the housing organization is supported in that effort with folks who are willing to help with it. So I think there are a lot of opportunities here for everyone on the campus to really step up and do what we, I think, do really well on this campus.
Actually go around our virtual room. Paul, let me ask you the same question. Concerns and hopes.
Well, look, the biggest concerns are the ones that Carol and Mark mentioned, and that's health writ large, both physical and mental health of our community are really paramount to us, and they're both they're challenged. They're just such enormous challenges. The social distancing and all of these electronic media for communicating with each other really do challenge people's mental health and their sense of connection. And everything that we're doing is so based on, I think, the extent to which people at Berkeley are really love to be a part of this community. It means something to them. So that's a real challenge, the mental health aspects. And of course, the obvious physical health aspects are still very, very concerning. Of course, what gives optimism is the creativity that we see. It's tremendous. I know that in the School of Public Health, they've established a series of faculty, instructor, staff, student communities that are working on important issues like public communication and health and wellness, what they can do in that space. And that's a model to me of the kinds of very interesting things that are going on. And finally, just to say, I think we will have learned how to be resilient in entirely new ways. So, as we pass through this crisis, which we will, we'll be in a position to be much more able to handle any future disruptions that might occur to this campus.
So Eugene, I'm going to turn to you, and I'm also going to put you on the spot a bit, and I apologize for that ahead of time. We live in an age of instantaneous conversations, and to tell you the truth, some people are already responding via Twitter with concerns that we're all being a little too upbeat, and that morale really isn't that high, and that some concerns about that there might be a disconnect between where some of us are in this event right now and where members of our community are. What's your response to that?
I actually do believe that there could be a disconnect. And today I was corresponding with my communications director about preparing a campus survey so that we could get a better sense for what morale is like, what people are actually feeling, where the anxiety is, and what sort of things we can do to address it. Because where we sit and it's hard to understand what's going on for everybody to experience. People don't like surveys. There's a lot of resistance, but particularly now when we're all remote, this is our best way to get information. And so we'll be developing something over the course of the next week so we can really figure out what people are experiencing and then what sort of interventions, targeted interventions it is that we can do. But since I'm also on the microphone, I want to take advantage to talk about the challenges and the opportunities. I think the biggest challenge, other than what folks have said, is really around this xenophobia, intolerance. I want to blame somebody. And it should be clear to everybody now that this is not a Chinese virus or an Asian virus. It is a virus that is affecting the entire world. And the challenge is to get people to understand that. But the challenge I want to issue to the people listening is that when you hear somebody use language of intolerance, call them out. Say, this is not something that's accepted here at UC Berkeley. And if you hear it out in the community, say the same thing. This is the only way we're going to get people to change their behavior is if we let them know it's not acceptable. On the opportunity side, I think learning how to work remotely is going to create tremendous advantages for us. I've heard in my time here at Berkeley that there are pockets of the campus where they're not comfortable with allowing employees to work remotely. Well, now we have no choice. And I think a lot of us are learning that it actually works. And we didn't, we survived and we're going to survive. And that will create more flexibility in the future for our employees who have long commutes or other commitments and they can't come to campus every day. We have issues with space on campus. And if we could deploy more of our workforce remotely, we could approach the problem from that angle as well. So I think this is a tremendous opportunity to learn so that we can be more efficient and productive as a workforce.
So Guy, I think this brings us back into your neck of the woods. You oversee a counseling sort of infrastructure here on campus. What's the sort of advice people are getting, people who do feel stressed, who are feeling overwhelmed, who, I will admit myself, I probably look at the San Francisco Chronicle's coronavirus tracking page 5, 6, 7, 8 times a day. We're all, I think, seeing ourselves react in ways that are abnormal given the abnormality of the situation. Can you give us some advice and some help at this moment?
Yeah, I think that one of the easiest ways that I can respond to that is that we really have developed a lot of resources for folks that find themselves not in their normal routines, and that can be really challenging from just a mental health and stability perspective. That your whole world within a week looks different. You might be working from home and you've never really done that before. You certainly don't interact with the same people during the day that you normally do. And so I think, to put broad strokes on it, we really do have a lot of resources available to help people think through this and process through this. And that's on the proactive side. I think for folks that are really struggling with this, if you're an employee, we have an employee assistance program, and we've really started to convert, again, more and more these consultations to telephonic and electronic. So please access the employee assistance program if you're really struggling with how to adapt to this new world, or you find yourself obsessing over the Johns Hopkins coronavirus number site. From a student and parent side, if you really feel like there are resources that you need, we've got an entire website that's dedicated towards this, and are changing our counseling and therapy, not only kind of individual, but possibly even some group sessions and some more informal, what we've been calling Let's Talk on campus. These more informal sessions that no medical record is created, but they're very informal therapy, to try to convert those electronically too. So I think you'll see a kind of an explosion of resources. And to Eugene's point, I think the opportunity is that we've known for a long time that the medical field is lagging in its capacity to handle people remotely and still offer kind of evidence-based, good practice, standard practice, medical and psychological care. And this has really forced us to accelerate that. And frankly, I think there's a lot of advantage to this campus. The other thing that I wanted to say that's not necessarily a response to that question, but I really didn't want to leave today and not say how proud I am of our campus and of the decision not to essentially close campus. I know that was an approach that some other universities took for very good reasons, I suspect, but I'm very proud that we did not do that, because I know, just from a student perspective, that some of the students that we house on campus and that we have on campus have they really don't have another place to go, and we would be sending them to a place that was worse for their health. And I know that keeping a campus open and providing services and converting to an online situation has been challenging, but it was the right decision, despite some other universities choosing something else. And so I'm just very proud of that.
Steve, we've been talking about the stress that people have been feeling, and I know that's certainly true in our student population as it is for our staff and faculty. And one of the things that students have been asking, I think, directly connected to that stress is whether finals can be canceled, and that class grades could be given based on coursework and midterms. So they no longer have to worry about that. What's our response to those sorts of questions or suggestions?
Yeah, that's very understandable, Dan, that students would ask us to consider something like that. Oliver O'Reilly, who is the chair of the Academic Senate, and Kathy Caution have both been working very closely over several weeks to address this question. That's largely why we went to the pass, non-pass option, is to provide some relief there. As the chancellor mentioned earlier, we're still moving forward with remote instruction. We want to finish out the semester, give students a chance to finish their courses out, secure the grade that they have been working so hard on for the whole semester. So I know it's understandable, but I think there have been a lot of discussion on this topic, and that decision to move to pass non-pass, I think, is one way to try to ameliorate some of the concerns that students have. I'm sure that the provost might have other things he wants to add to this.
Yeah, thank you, Steve. I mean, first of all, let me just say, to the earlier point about the possible disconnect, and I think that's very real, and I think the fact that you're seeing that on the Twitter feed is important. It is very stressful. It's a situation where many people are fearful, and that we have so much uncertainty, so it is very hard. And also, we're asking all of us of each other so much right now to try to essentially transform the university into a different modality, while there is all of this extreme anxiety and a genuine public health emergency. It is really stressful. And so I think if we didn't convey our sense of that, then I'm sorry, because it's very real. And yesterday I was in a discussion with some colleagues trying to plan for yet another way to try to adapt ourselves. And the staff member said, hey, wait a minute. This is enough. We can't do that. It's just you're asking too much now. Let's hold off and try to find a way to do that at another time when things have calmed down a bit. And I appreciated that very much. And I think that I would urge staff who are feeling that it's too much to really speak up and to not feel cautious about saying that, because I believe everyone will be respectful of that and try to help people through, and it will help call attention to their need.
Carol, I want to ask you, I know I don't want to get too personal, but I know you're currently living with at least one of your children and a grandchild or two. How are you balancing the personal and professional during these times?
Well, it's wonderful to be able to live with a community of family at this point. It really relieves the kind of social isolation, and I try to make the space for my work. I actually, as you can see from this video, I've been coming into the office where I've been socially isolating myself, and really trying to do the best to balance both, as I'm sure many people listening are, my responsibilities to my family and my responsibilities to my professional job.
Let me ask a question for all of you. Where are you getting the information you rely on to make the decisions and engage in the planning that you're doing right now? Let me start, Steve, with you. Where do you go?
Yeah, that's a great question, Dan. Well, we have a very tight network with the crisis management team. I mean, we meet every single day and we share information, and we've got experts from across the board. Mark's on that body, Guy's on that body, Eugene, the chancellor joins us sometimes, the provost chairs that. So we've got lots of experts, I think, that have access to lots of information. In terms of student life, I really try to stay in touch with my team to make sure that I've got my ear to the ground so I can hear about what's happening each and every day. We've got some very hardworking, devoted folks that actually live in the residence halls, our resident directors, who interact with students every single day, and they're a wealth of information for me. All the leaders within the Division of Student Affairs have a very tight network with their teams, and so I really am getting information from my team members in terms of things that we need to do for the campus, and then we're relying on other experts to provide us health information, such as Guy, so we are acting in the way we need to act.
Others?
Well, we're meeting with, in our crisis management team, we have people that we can invite in to help us, people from public health, from other areas. I've been in touch, and I think many colleagues in the administration are in touch with student groups and employee groups to hear about what their concerns are and to be getting information from them about what's happening. And we're certainly in touch with all the other UC campuses and with many other universities to be hearing about how they're dealing with things. I know, Guy, you're in touch with the public health officials at all levels.
Yeah, I was about to say, I'm incredibly fortunate that the team here is just great. And we've got really national leaders just within University Health Service that I can rely on that give me great information, give me great guidance and counsel and wisdom, not only from the medical side, but from the counseling and social services and even health promotion side. We're lucky that we're at a campus with world recognized epidemiologic experts and public health experts. So I just feel like I have the world at my fingertips here. And not to mention our local public health officer, Dr. Lisa Hernandez. She is just in constant contact with our medical director and has just been incredible to work with. So I feel like in one sense I've got a very easy job because I've just got incredible people that are passionate about this work. So, and again, not to sound too disconnected, because I know we've got a huge medical crisis on our hands, but I'm just so optimistic that we will get through this. And I know that there might be the worst to come on the medical and public health front, but I'm optimistic because we have such great people that we'll get through this and come out on the other side even stronger.
Please go ahead.
Jump back in if I may. I also think it's really important to just highlight the work of our student leaders. I stay very connected with ASUC student leaders, and as I think many in our campus community know, that they're very devoted, energetic, committed student leaders. And so we get lots of information. I get lots of information from them that I then share with my colleagues. They very much want to be thought partners with us in these difficult times. And so we rely on them, lean on them quite a bit to just manage the things that we manage each and every day.
That's a great point, Steve. We've even used, had engagement with students actually doing some of the work. The Berkeley Medical Reserve Corps are made up of students. So we really have a phenomenal kind of student body that we can partner with in a lot of these, not just from an informational side, but also from a planning and a work side. So it's a great point.
Our student volunteers have been amazing. So whether it's the EMT group we talked about or as CSOs, they've stepped into jobs that they're interested in, but I don't think they would have thought this would be something they'd be doing while they were in school at Berkeley. But they are doing a remarkable amount of work for us, and it's been a huge, huge help.
And if I can just add too, just quickly, sorry. This isn't the first issue we've dealt with this academic year, right? This is. I mean, in the fall, we also had issues related to the power outages. And so I just think about and just reminded of our resident assistants, for example, in the residence halls, who have been helping us all year long address these issues. And so I think this gets to some of the concerns earlier that have been discussed related to resilience and people really feeling tired and a tremendous amount of fatigue. And that's certainly understandable. But I think that's where it's really critical for us to try to continue to rely on each other, support each other, so we can get through this academic year.
So we're just about at the end of this event. Carol, I just want to ask for some closing thoughts before we say goodbye for now.
Well, my closing thoughts are hope that we all stay safe, that we stay well, that we work together to flatten the curve of this virus, and also gratitude to the community for holding together in what are extraordinarily challenging times.
Thank you. I want to thank all of you for joining us. I want to thank everybody who tuned in for this. This was obviously an initial effort. I think we can also see some of the effects, the fact that we're all isolated. This ability to connect and also to learn. We're going to be reading your tweets and your Facebook posts. We want to see and receive the questions that you have, again, through the berkeley.edu homepage. We anticipate having more of these, and we are certainly committed to a continuous stream of updated information as the campus seeks to respond to an extraordinary series of events, an extraordinary crisis. And for the time being, we just wish that you and your loved ones stay well, stay safe, and stay distant. Enjoy the rest of your day.
Thank you.
Thank you.
Thanks, Dan.
Thank you.